some quick logistics. So as audience members, you have been put on mute for the webinar. However, if you'd like to ask a question, please put your question in the chat box, which you'll find at the top right menu of your screen, and type in your question. And we'll do our very best to address your questions during the Q&A portion at the end of the session if time permits. If you would like to ask a question, but you would prefer it not be visible to all our attendees, please, or we can want to follow up after the session if you prefer, please email us at events@prospercanada.org. For those who would like to use closed captioning, on the menu bar on the top right of your screen, click the 3 dots with the word More under it, then click Language and Speech, and then turn on live captions. We'll also send you within a few days a copy of the slides from this presentation, as well as a link to the recording of the webinar and responses to any of the questions that we don't get to today. And I see that it's been put in the chat, but just another reminder that if you are using a screen reader today, we suggest that you disable chat so that you don't get simultaneous chat and presenter feeds. So the next slide will show you that you see is a little description of our 3 organizations of our speakers today. So I'll give you just a, maybe 30 seconds to read that as we wait for some more people to join us today. So I'm really happy to introduce our speakers for today's webinar. Helene Boyd is the Executive Director of Disability Alliance BC. Since 1977, DABC has been a cross-disability voice in British Columbia. As a provincial nonprofit organization and registered charity, their mission is to support people with all disabilities to live with dignity, independence, and as equal and full participants in the community. They champion issues impacting the lives of people with disabilities through their direct services, community partnerships, advocacy, research, and publications. Dr. Reuben Ford is a research director at the nonprofit research organization Social Research and Demonstration Corporation in its Vancouver office. We'll refer to it as SRDC. Since 2003, he has directed SRDC's team investigating and evaluating new approaches to increase access to post-secondary education across Canada. This includes Life After High School, Future to Discover, and BC Avid, as well as analysis of employment and social assistance programming. He holds a PhD in geography from University College London and is a credential evaluator as recognized by the Canadian Evaluation Society. And I'm Janet Flynn, and I'm a Senior Program Officer in Prosper Canada's Program Delivery and Integration Department. And I work with community partners to embed financial empowerment initiatives into their existing services. Prior to joining Prosper Canada in 2017, I had an extensive career in the private sector in finance, and I enjoy volunteering in ways to promote financial well-being. So I invite you now to share your own acknowledgements in the chat if you are joining us from other areas. I'd like to start by acknowledging that we are joining you from Toronto, which is situated upon traditional territories. The territories include the Wendat, the Anishinaabe Nation, the Haudenosaunee Confederacy, the Mississaugas of the New Credit First Nations, and the Métis Nation. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Today, the meeting place of Toronto is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in the community on this territory. So, what are our goals for today? We're looking forward to introducing you to a tool called the Disability Benefits Compass, and this will help increase access to benefits for people with disabilities. We're going to share outcomes and learnings in the evaluation of the Increasing Access to Benefits for People with Disabilities project. And finally, we'll have a call to action. What's coming next, and what can you do to help increase access to benefits for people with disabilities? So again, today is the International Day for the Eradication of Poverty. It's a day to promote dialogue and understanding between people living in poverty and their communities. So we're excited to be able to share these learnings with you today. We'll start with a warm-up poll, and then we're going to take you through an overview of the project, the key barriers in accessing benefits, and principles in designing an accessible service, as well as the service itself. We'll introduce the Disability Benefits Compass tool with a live demonstration. We'll share the project evaluation. What exactly is it? And the outcomes and the learnings. And then, as we mentioned, talk about what's next, what's possible, and a call to action for you. Then we'll wrap up with another poll, and then we'll welcome your questions. So the project, which is named the Increasing Access to Benefits for People with Disabilities, was a 3-year project pilot funded by the Government of Canada's Social Development Partnership Program, their disability unit. And it ran from July 2020 to just this past July 2023. And it was piloted in British Columbia with our partners Disability Alliance BC, Plan Institute, and our evaluator SRDC. The ultimate objective for this project was to develop an effective service with the potential for sustainable scaling that can support people with disabilities at no or low cost to them to access government benefits that they're eligible for but not receiving. And we'll also show you this service today. So let's start with our first poll, because it would be really great to get to know a little bit about what you do. And the poll will pop up there, and you can pick whatever number of answers apply for you. So what is your role with respect to access to benefits for people with disabilities? You receive benefits, you don't provide access to benefit supports, you provide access to benefit supports, or you also provide other types of supports for people with disabilities. So I'll give you about maybe a half a minute to put your responses in there. Okay, we're a little bit more halfway through. Maybe another 10 seconds. Okay, I'll give you 5, 4, 3, 2, 1. Okay, we'll close the poll. And looks like that the majority of our attendees, of those who have responded, 61% of you provide other types of supports for people living with a disability. And about a quarter of those who responded do provide access to benefit supports. And we have about 11% don't provide supports and a small percentage who do receive benefits. So we have a variety. And so for those of you who put that you do provide access to benefit supports or other supports, We welcome you to share what kind of support it is that you provide in the chat. It would be really interesting for us to see what you do. So thank you for participating in that poll. I'm just going to give you a little bit of an overview of our project. The problem that we're trying to solve, which I'm sure pretty well everybody on this webinar is more than familiar with, is the many barriers that people with disability face in trying to access benefits. And that results in billions of benefits being unclaimed every year. And there are organizations such as those who've mentioned it on our poll that offer services for people with disabilities. But what we know is that the demand far exceeds the supply. And today in Canada, about 40% of people living with a disability are also living in poverty. So it's a very big problem. So our objective was to try to develop a service to help people living with disabilities access benefits, make it easier for those who may not have access to one-on-one support. And then finally, document the process, test the service, evaluate, and share the results, which this webinar is the first step. So our objectives included documenting the benefit journeys that people with a disability go through when they're trying to apply for one of the benefits, and learn from that. What are the strengths, what are the weaknesses of that process? And then develop and share insights on effective and promising approaches to be able to remove those barriers that they face. Through the project, we co-designed and developed and piloted an access benefit service in British Columbia, which we'll show you today. And then also share those insights. And we have tools and resources that we'll also have available for your use. So the live link that you see at the bottom of this slide that you'll have access to will take you to all documents and knowledge products developed during this project for your use and your review. So the key barriers that we found during the course of the project, which again, I'm sure you're all more than familiar with, and we had throughout this process, people living with a disability and staff at our partner organizations participating in every aspect of the project. The main barriers that kept popping up consistently were that the benefit application processes are complex and unclear. And I know that everyone's saying, yep, that's kind of a given. The participants that we spoke to felt that the system was designed to keep them out, and that getting denied, unfortunately, was viewed as part of the process. And the burden placed on healthcare providers often gets passed down to people with disabilities. They may not even have a doctor that can accurately diagnose, their daily living impacts. And also, doctors can also charge fees that are prohibited for some people who are living on low income. Every step requires time, energy, connections, and access to resources that many of the applicants don't have. And the literacy requirements can be quite high. So people who are living with a cognitive disability or multiple disabilities may not have access to supports that can help them navigate the complex process. Also, people felt that the process itself can be very dehumanizing. And we heard this many, many times in the interviews, that the benefits application process can be re-traumatizing. They made to feel that they have to prove and reprove their disability just to get a small amount of money. And those who interviewed described the partners' advocates as saviors, bringing compassion and humanity back into the process. But one of the main pain points is that there's a far larger demand for that type of support than is supply. So the live link that you see at the bottom again will take you to an insights document that the project published in the first phase of this project, which will take you through a deeper dive of the barriers. And it also presents a very informative lived experience of one of our research participants in his journey trying to access benefits. So once we learned all of the barriers and understood what type of challenges we wanted to try to tackle, we had key principles that our participants identified that must go into the development of an effective service. And those principles are: give a consistent human relationship throughout the process. So even if someone is navigating the access to benefits process themselves, ensure that it's available when needed and that people know where to go to get help. Build a roadmap to follow. So since the application process can be quite complex, present the information in an easy to follow step-by-step manner and include tips, talk about challenges, and provide the availability of help at each step. Humanize the experience with straight talk. So we heard this quite often, tell it like it is. Like, please don't sugarcoat it. Tell us what's involved. Don't gloss over the challenges that might come along the way. Activate new advocates and navigators. So similar to the first point, provide long-term support by offering connections and referrals to other organizations that can assist with other important matters. Get the word out to the most disconnected people. So people who live in rural or remote areas and who may not be near getting in-person support, and even for those specifically that don't have a permanent address, who may not even be aware that the benefits exist, get the word out so that they can become aware and know where to go to get those benefits. And then finally, make it accessible for everyone. Provide the service in an accessible way. Ensure everyone can get access to the service regardless of their disability. So we kept those principles in mind as we went through and developed the access to benefits service model. And as I mentioned, it's really important that we designed this service with those who would be using it and make sure that they felt that they were reflected in this service. So in our service design in this development, as I mentioned, we had people with disabilities and the staff at our partner organizations involved in every step of the way. So the service that we're hoping to share with you today is a 3 functional component service. The first element is a self-serve disability benefit navigation and advocacy using a tool that was created with people with disabilities and staff during the project called the Disability Benefits Compass. Secondly, an online broader navigation tool called the Benefits Wayfinder. And this has benefits beyond disability benefits. And it goes by type of situation. So like, for example, someone is having a baby, someone lost a job, someone is now looking after someone who's elderly, those type of things. And then finally, the direct one-on-one benefit navigation advocacy. So this is provided by organizations supporting access to benefits navigation for people living with a disability. So we're having it so someone could do it themselves if they have the capacity and willingness and technology. They can look at benefits beyond disability, but again, they still have an advocate that they know they can go to if they have questions or if they still require support. And that advocate can provide a more holistic navigation assistance. So supporting not only benefits, but with other things that are needed, such as housing, tax filing, and others. Support should be available in a holistic way, using the 3 functional components and our existing tools and resources, but it should also be offered according to the person's needs, their capacity, their wants, and their technological IQ. So what you'll have access to in about a couple of weeks, we'll be sharing this out afterwards, but you'll have a program manual and an accompanied service model graphic. And you see there is just an example screen print of one. And what this is a guide for organizations who are interested in either starting access to benefit supports for people with disabilities or enhancing what they may already offer. And the link to get to this in a couple of weeks is provided on slide 11. So you'll find it there when it's available. And it takes you through the end-to-end of someone first hearing about benefits to applying, perhaps meeting with an advocate, and then the end of process follow-up. And it depicts the journey of the client and the various staff members. So finally, I'd like to take you through a quick demo online of the Disability Benefits Compass. And I'm just going to share my screen. And you'll see here that, as I mentioned, this project was in British Columbia, but because the tool was working so well, it was expanded to include all provinces and territories, and it was launched publicly last November. It has, firstly, up here, you select your province or territory. It's available in English and French, and you can have light or dark mode. And I should mention that this tool was fully accessibility audited to ensure that it is accessible for anyone who would like to use it. At any point in the process, down at the bottom and on every page, you'll find a Get Help button, which will take you to a page where you can click, depending on the benefit you're looking at, and find out which organizations will provide free help. So you can contact them with their questions and get help. And everyone that we include on here does not charge a fee. It has a glossary of terms. It has links to resources that our partners and others have created. And again, it has little information here to understand how to use the tool, including a video that our DABC partner created. And everywhere in here, you'll see blue boxes with important information that someone should read first before proceeding. Within this website, we have 4 key disability benefits. So those that we worked with said, at a minimum, someone who is disabled should be aware of these and see if they're eligible. If they already have all these, then they can go to the Benefit Wayfinder, which this links to look at what other disability benefits might exist that they can take a look at, or other benefits beyond disability. But for everyone, they'll get whatever the provincial or territorial benefit is, the Canada Pension Plan Disability Benefit, or the Quebec for the Quebec folks, the Disability Tax Credit Certificate, and the Registered Disability Savings Plan. And down below is really where the value add is beyond what you might get on the government website. This is that knowledge that the people with disabilities and the experts, so the partners who work with people getting access to benefits, have provided. So tools that have been developed, hints, tips, frequently asked questions, and these cards can be accessed as the person goes through the steps of applying. So things like, what do you do if your application is denied? Because a lot of people we talked to thought that was the end of the road, but it's actually really the beginning. Definitions that they might need when completing forms, guidance for their doctor and how to fill out the form to accurately describe the impact to their daily living. So lots of really rich information that each step of the way they can find. Just really super quickly, just going to show you one of them, the disability tax credit. So you'll see there's an introduction, talks about the eligibility, the step-by-step application process made super user-friendly, what to do after you apply, whether you're approved or whether you're denied, and then a compilation of the frequently asked questions and the resources, which are at each step of the way. You see here that it's very simple to go step by step. If you answer yes, you'll proceed to the next step. No, or I'm not sure. It's going to show you what to do with live links. And then the frequently asked questions or tips at that step. And then finally, after you apply, what to do, what to expect, and what to do if you're approved or denied. So I know that was a very quick demo, but please feel free to send questions after the webinar at any time if you'd like to find out more about it. And now I'm going to pass it over to my colleague Ruben, who's going to take you through evaluation.
Thank you very much, Janet, and hello to everybody. Thank you for joining us today. You've heard that evaluation is a critical part of this project. So what do we mean by evaluation? It's essentially a process to learn about whether a venture like this is making a difference. And by extension, we also hope to learn how we can make it better. Each project should have an evaluation process that prioritizes what the stakeholders in that venture most want to know. Each evaluation then adapts to the context depending on the purpose, and we use different methods, adapting to working in different settings, engaging with different populations, collecting and using different types of data to develop evidence about how the project is doing. So on this slide, you can see three definitions of evaluation: the process of determining the merit, worth, or value of something, a process undertaken for the purposes of improvement, decision-making, enlightenment, and persuasion, and using systematic data-based inquiries about whatever is being evaluated. And really all three apply at the same time. So moving on to the next slide, applying what type of evaluation would be appropriate for this project. We were thinking about the project's purpose, what the evaluation should be trying to do, formulating questions that we most want to have answered. And here are some of those questions and the purposes that we gathered that applied to this project. Most evaluations will answer some key questions like the first four you see here. What are the key elements of the service? How does it work? Who are the users and what have their experiences been? What impact has it had on the access to benefits? How has it impacted their lives? What works well and what needs improvement? But we also worked on the evaluation with the hope of helping to share lessons learned across the different groups that were participating and from the location where it was originally piloted in BC to make them relevant to those elsewhere. And the reason for doing this, there are many, but one is to avoid coming to the wrong conclusion about whether or not this is making a difference or what aspects of it are making a difference, to help decision makers, including people who provide funding for these types of tools, to make decisions about what's appropriate to do in future, what has worked in the past, what's likely to work in the future. And thus, in that way, also helping to justify funding for projects that already happened, but also for those that can proceed in the future. So moving on to the next slide, the type of evaluation we were undertaking with this project is one that's appropriate when you're starting from scratch to develop a new tool and a new process. And we wanted to develop an evaluation process that would support the learning as the project went along, that would provide feedback not as this cartoon suggests at the end of year 3, but every meeting along the way, every month there would be evaluators present who could provide feedback on how the project was going. And this type of evaluation is called developmental evaluation. Often evaluation is something people only think about at the end of a venture, but by then it's often too late to do well because the relevant data haven't been collected. Or it might not be very useful because you can't apply the lessons from that to the project once you've reached the end of it. And developmental evaluation, as it says here, tries to be flexible and focused on learning to provide feedback throughout the process. So the information coming from the evaluation is timely and relevant, and helps those who are trying to develop, design, and test new approaches with real-time feedback. And in that way, the initiative can be adjusted to help achieve the intended objectives by the end of the project. So moving on to the next slide, these were the kinds of data that we were working with in this project. There were two types, really, those about the development of the tool and the service, and those about the use of the tool and the service. SRDC was present at every one of the meetings the project team had to ensure that we observed how decisions were being made, what information was being gathered, how to provide some of that information. We reviewed the project documents to see what was being taken on board, what information was already available, what new information was being generated by the project. We undertook key informant interviews with the team members implementing the project. And we observed the workshops, part of the co-design process, working with people with disabilities and advocates to learn more about the way in which a tool like this and a service like this should be designed. So we work to collect those data and provide feedback on the results as the project proceeded. Then towards the end of the period on the previous slide, we had the data that was used for understanding how the tool was being used and how the service was being used. There were data from surveys. There was what's called a Hotjar survey. This is a survey that pops up for users of the website that helps to provide feedback on who's using the tool, how useful it is, and what else they might want to see by way of feedback. We also have a survey that was linked from the website for those who were willing to undertake the longer survey that SRDC had designed. This survey had very low take-up, and we weren't able to use it in the evaluation, unfortunately. We got a great deal of data from the website analytics, from the way in which the website was being used over its first year. And we undertook in-depth interviews with the users of the website. We repeated them with people who we interviewed earlier so we could see how their use changed over time. And we also talked to people who are new users and frontline staff. And all of our results, what we learned through the course of the project and what we learned through the use of the website, are documented in the report, which documents how we applied lessons over the course of the project. And at the moment, you can see here all the different types of results that are in the report, the step-by-step documentation of how the project unfolded, the insights that we gained, how those insights were used, the challenges the project faced and how the solutions were found. We document how the tool was used, level of satisfaction with the tool, the changes that we can attribute to use of the tool that people told us changed in their lives as a result of using it, improvements that people recommended, and what else might be needed to support people with disabilities access benefits beyond what the tool could do. This report is available through the link that you see in the chat. For the remainder of this discussion of the evaluation, I'm going to concentrate on what we learned most recently about the implementation of the tool, but you can read about the whole history of the project in the report. I'm going to be answering questions in terms of the what, the how, the where, and the why that you may have. So I'm going to start with the what. What did people access, particularly people in BC using the initially piloted version of the Benefits Compass? Well, as you can see here from the users from the first year in which the Compass was available, more than half were concerned with disability assistance for people with disabilities, in particular the process for applying for and receiving that benefit, the Persons with Disability designation. There were around about 18% who were interested in the CPP, the Canada Pension Plan Disability Benefit, and equivalent proportion for the Disability Tax Credit, with around 1 in 9 interested in the Registered Disability Savings Plan. One of the advantages of this tool is that it allowed case managers to refer their clients to the tool rather than giving them a collection of links to a wide number of different websites that gave information. There was one place where they could send them to find out about all 4 of those benefits and how to receive them. The slide we're looking at now is derived from the website analytics and interviews with users, where we're really looking at who was getting engaged with the website. The majority of people using the site, around 2/3, were people with a disability looking to find out more about benefits. But around 1/5 were family members or advocates for a person with disability trying to find out more information. About 6% were staff members of organizations, community-based organizations supporting people with disabilities, and a roughly equivalent proportion were coming from another source. The most common link that people were clicking on to get to the site were those from the Disability Alliance of BC. Around 38% of the people arriving at the website did so through the Disability Alliance of BC website. And then an equivalent proportion were coming direct, either by typing the URL into their browser or coming from Google. And there were other sources, but none of them accounted for more than 3% of the users arriving at the site. Moving on to the next slide. The results here come from the Hotjar survey and from interviews with users. We're looking at how easy or helpful the website was found. You can see there's quite a range from the people who responded to this survey, where low score means that people weren't finding it easy or they weren't finding it helpful, to 10 where they were finding it easy to use and helpful. But on average, more people were finding it easy to use than hard, and more people were finding it helpful than unhelpful. In all, about 38% of the people using the website found what they were looking for, and most of the others, when they were asked what they were looking for that they didn't find, were looking for something the website wasn't trying to provide. So we have this quote here on the side, which says something about the user's experience, that it isn't just a one-time use. I still find myself going back every month and seeing if there's any new information out there. So even for a person like me, who's kind of used to services from the government, I still go back for a refresher and for more information. Going to move on to the next slide now, which tells us a little bit about the places where people went to using the Compass site. It's hard to track, really clearly the journeys that people made through the site and the information that they were gathering. But one useful way to look at it is in terms of where they ended up. What was the last link that they clicked on? And we can see that a lot of the types of information that people were looking for related to the disability designation for disability assistance in BC, people looking to understand better what impact on daily living activities meant, getting various types of help with their application, very practical considerations such as how to find a doctor or a nurse practitioner. But there's also people wanting to know more kind of practical tips on things like how they would set up a My Self-Serve account, or how you can help your doctor in completing the DTC medical form. Very practical pieces of advice that people were getting from the tool. And the repeat users who we interviewed added that as they became more familiar with the website, it became easier to find these pieces of information on subsequent visits. But as you can see, there's lots of very useful information in there that people were using, many people were using over the course of the first year. So I'm now going to tell you a little bit about the why people were using it, that we learned mainly from the in-depth interviews. Repeat users that we spoke to told us that the website had made a positive difference in their lives. In some cases, it was a game changer that helped them understand how to qualify. It helped them with the success of their applications, or it supported their applications. We don't know whether they were successful yet, because at the time that we interviewed them, they were still waiting to hear. So here's some quotes from those participants in those interviews. The government website was not very user-friendly at all. It's more government lingo. I was after going to the website, was able to help me understand what the disability tax credit is, what grants and bonds are, and how I can qualify. So for me, it was huge, kind of a game changer. And the other user says the website helped me be successful in my application. I previously worked with Disability Alliance BC, and I'd gone down there in person to their office. But part of my disability is I have social anxiety and mobility issues. So it was a challenge to even go down there. But the website provided me with the same information and more, because I didn't have to leave the house. So it included everything that Disability Alliance did, and the extra benefit was I didn't have to leave my home. So those are two users kind of explaining why the website was useful to them. Moving on to the kind of conclusions from the evaluation, we asked those users about what else might be needed to help support them in accessing benefits. And still, of course, the application process can remain obscure and difficult to navigate, and the eligibility requirements can be very complicated. The website can help you navigate those, but doesn't change the application process or the eligibility requirements. And the other major concern people had about what might be needed is improvement in the speed at which applications were processed. The wait times for those outcomes are very long. People were asked what would be helpful for the benefit system as a whole, making the application process more straightforward, increasing information, particularly in the Compass, about the Bill C22 for a new benefit for people with disabilities, new federal benefit, making more resources available on mental health support, and also including more information on the registered disability savings plan, because those benefits tend to be underused. So those are the main conclusions from the evaluation, and it led to many discussions within the team. And Helene's going to take you through some of the next steps that we've been discussing about what needs to happen going forward. Over to you, Helene.
Thanks, Ruben. Pleasure to see everyone here. So I'm going to be talking about 4 categories here listed on the screen, and I will say them out loud. The first one is understanding the Disability Benefits Compass as a service tool versus advocate and navigator approaches. So the way that I perceive the Disability Benefits tool is it's a tool within a larger toolbox that supports people with disabilities. And it's also a spectrum of support. So the Disability Benefits tool is one that provides a lot of information that is meant to be a step-by-step type of guide that allows a person to apply for benefits on their own. Whereas with advocate support, a person with a disability meets with an advocate, and the advocate works through the application with them. And then the navigator approach is one in which a navigator may support with benefits, but also looks at the more holistic services needed to support people with disabilities in terms of like housing and employment and things like that. And sometimes navigator types of approaches are done within nonprofits, possibly social workers as well. And so that's a range of support, and each person with a disability may need different types of support at different times, depending on the access to benefits and services that they're looking for. So it's good to have the Disability Benefits tool as a tool within the toolbox for certain times, for certain people with disabilities. It's also good to point out that the Disability Benefits Compass and all of the very detailed information within the step-by-step pages within the website are based on the help sheets that Disability Alliance BC has. But beyond that as well, our help sheets give the brass tacks on what is needed for each of the benefits, whereas the Disability Benefits Compass distills the decades-long knowledge of our advocates into this website, which was really enjoyable to do because it means that more information is out there for people to use, not just people with disabilities looking to access benefits and services, but also those who want to support people with disabilities as well. The next category in this screen says support that acknowledges disability and intersectional identities. It's good to know that the Disability Benefits Compass is in its first iteration. I only hope for it to improve over time should Prosper Canada get further funding to support that. And what that would possibly look like is to ensure that the Disability Benefits Compass is helpful to a range of intersectional identities. some examples of that, for Indigenous people with disabilities, they do have a slightly different way to access provincial disability assistance if they live on banned land, and usually Indigenous people with disabilities look for assistance through BCANS. That's BC Aboriginal Network on Disability Society. And it would be good to be able to integrate in the knowledge of Indigenous disability support within the disability benefits compass to make it more inclusive. Another example is newcomers with disabilities. Newcomers to Canada also have additional integrated overlapping needs beyond just their disability. They are also looking for settlement type services, and providing an integrated approach to other types of services within the disability benefits compass serves to acknowledge that people with disabilities come from a variety of different access points to needing these services. So perhaps in the future, next steps could be to translate the disability benefits compass into different languages. And the point of this all is really to present this information in different ways to reach more people within society and to make this more inclusive. The third category in this screen says integrating the tool into existing approaches and networks. So I wanted to explain a bit more about how our advocates at Disability Alliance BC integrate the disability benefits tool within their work with clients. So I mentioned before that lots of the information on the website is distilled knowledge from our advocates, and it can be extremely helpful to the client to be able to help them navigate the website ahead of an appointment with an advocate, so they are more aware and they understand better about how the advocate will assist them. And knowledge is power. They would be able to take this information and possibly ask further questions to the advocates because they understand the process a bit more. And overall, that will help the client journey in accessing these benefits. And I think just overall making this information transparent to people with disabilities, to those who want to support people with disabilities, will make the whole journey much better than it currently is. It's a bit inhumane in some circumstances. I also want to acknowledge the great network of advocacy organizations throughout the province of BC. Disability Alliance BC is just one of them. There is a good network called POVNet that connects all of the advocacy organizations that serve people on low income. It's good to note that within our social welfare system in BC, that's income assistance and disability assistance, that over 90% of people accessing social welfare are people with disabilities. So even if an advocacy organization out there doesn't have disability in their name, most likely they do serve a great number of people with disabilities, and having this tool to be used within their advocacy organization will also ensure that there is better inclusion and knowledge surrounding the needs of people with disabilities. Another point to mention is that it goes beyond advocacy organizations. Of course, there are other service providers that are integral in the community that support people with disabilities, even if they don't have the word disability or accessibility in their name, such as neighborhood houses, community centers, employment service providers, social workers, etc. And then the last category within this screen says taking lessons learned to inform future benefits service delivery. So of course, on my mind is the Canada Disability Benefits, apologies, that was passed into law earlier this year. And I certainly hope that the federal government can take the lessons learned from how convoluted and overwhelming our current disability benefits services are, and to make a Canada Disability benefit that is more humane, but also really looks into how to provide access to a federal benefit in different ways, not just online, uh, not just in person, but also like ways to meet people where they're at, particularly for those who are rural and remote and who may not be anywhere near a town that has support nonprofit organization. Which brings me to my other point, to really ensure that the Canada Disability Benefit is done with compassion and humanity, as Janet pointed out earlier. The process needs to ensure that the system, the Canada Disability Benefit system, is integrated within the social services community, not a step above the community within the federal government. And what I mean about that is this needs to recognize the dignity and agency of people with disabilities in accessing services, and not as a way to create further barriers for people in accessing income supports in particular. So the ESDC, that stands for Employment Social Development Canada, is the branch in the federal government responsible for designing the Canada Disability Benefit. And the first draft of the Canada Disability Benefit, I do not know exactly when that will be drafted, because they still need to budget the benefit. But once they do draft it, it will be published in the Canada Gazette, and that will be an invitation for the entire society to provide feedback on what the design of that system looks like. And the call to action is really to make sure that all of us have a voice in providing feedback on that and ensuring that it's designed by and for people with disabilities as much as possible, and that the implementation is done in a dignified way. I'll stop it for there, and I will pass it back to Janet, I believe.
Yes, thank you very much, both Ruben and Elaine, for your presentations. It's very informative, and I hope the audience has learned beyond what they already did know in the topic, and find some of these resources and next steps something that you'd be interested in proceeding. So now we're going to go to a poll. So now that you've learned about what the project entailed and the type of service that we were developing, we'd like to find out if you're interested in learning more with respect to starting or enhancing access to benefit services in your own organizations. So again, you can select all that apply. First one is how to learn more about your client's needs, building an online tool, learning about the progress you are making, ensuring information is up to date and accurate, and hiring and training benefit advisors. So please feel free to click away. And if you are interested in Prosper Canada or our other two partners contacting you after the fact on any of these topics, please also feel free to put your name and organization's name in the chat, and we can follow up, or again, you can send us an email afterwards. I'll just give you another 30 seconds for that. Okay, about half of the participants so far have responded. Okay, maybe I'll give you another 10 seconds. And 5, 4, 3, 2, 1. Thank you. So again, it looks like it's spread across all of the categories. So that's fantastic to find out what you might be interested in next. And again, please feel free to put your name and organization in the chat, or send us an email afterwards. So we'd like to open it up. I think we have maybe just a few minutes for questions. If anyone would like to put a question in the chat. I don't think I saw any questions so far in the chat. One of the questions we usually get when we present the Disability Benefits Compass is how often is it updated? And we venture, since it's pretty new, to update it a minimum, a full review once a year, and then sort of a top level view a second time in during the year on terms of the dollar amounts and anything new that might have come up or any changes to the benefits. Yeah, just checking with Sharmeen. I don't think I see any questions. So just to let you know about an upcoming webinar for frontline practitioners on November 9th. We have the ability to manage, so supportive tools to help community members manage their expenses, savings, and debt. And again, in the presentation, you'll have the live link to register for that webinar. And at the very end, we have our contact information. So on behalf of Helene and Ruben and Sharmeen and Jenny and our wonderful interpreters and our CART representative, we'd like to thank you very much for attending today. And we look forward to hosting other webinars with you in the future. So enjoy the rest of your day. Thank you. If you could put the contact slide up, Jenny, I think it was a request to have that again. Perfect, thank you.
Going to, we would love your feedback.
Hey, thank you, everybody. I think we can close presentations. Bye.